EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. It's so nice to be back again, week after week. People are always saying, how long are you going to do this? And I say, as long as I have great guests that we've been able to bring forward, like today. I just cannot imagine not using my lunchtime to record or do anything different. So happy to have Brooke Flood here today again.
Thank you.
We do this regularly, about once a year,
Yes.
because Brooke is the early learning guru for the school district, a principal.
Thank you. Yes.
Yes.
Thank you.
You're very welcome. You do wonderful work with all of our children, and our children, honestly, are just the joy of all of our programs. And so we entrust them to you,
Thank you.
when they're not seeing the providers for medical, dental, or behavioral health.
Absolutely. Absolutely. We're honored to have them and just so blessed. I know our programming here in the amazing school district of Indian River County, where we are the home of the Florida Superintendent of the Year,
Isn't that
Dr. David K.
something?
Moore. I know we're super excited, as well as a national finalist for Superintendent of the Nation.
And to be able to say out of the entire nation,
Yes.
he came in so strong.
He sure
It didn't
did.
surprise us.
Exactly.
Because we have watched him at work and seen the strides that he's helped our school district make in each of our schools with each of our students. Better by kids, as he says.
Absolutely.
Yeah.
And stronger together and best by kids.
Yeah.
Absolutely. Just such an honor. And he does have that heart for early learning. So I am stoked beyond belief that I can lead and guide our department. We're close to about 400 students between our different programs.
Wow.
Between our voluntary pre-kindergarten program, our students with disabilities, our 3 to 5 year olds, and our itinerant students. So our students who are in the private preschools who may need some speech, some language, or maybe they have a developmental delay. We have staff that goes out to see them as well. So I think right before spring break, we were at about 397 students that we were serving.
What an impact.
Thank you.
That is tremendous.
Love it.
So you mentioned a couple of the programs.
Yes.
But I don't want us to get chatting, as we always do.
We do.
And then
We
we
can
run
sit here
out of
forever.
time and go, oh, darn, I meant to
Should have
ask.
talked about that.
Yeah, so let's start with the most important thing, time-wise.
Time-wise.
Okay.
Yes.
Coming up April 5th.
April 5th. We are so excited. That is our Cruising into Kindergarten event. And to anybody who has already received their special, I don't know if we can see this, their special invite, we did have a venue change. So we're really excited about that. We are going to have all of our families gather at the School District of Indian River County's district office versus early learning. So we've got a bigger space. We're going to roll out the red carpet for our Grand Prix, which is going to be so exciting.
If you couldn't see it because of the radio, it really looks like a Grand Prix flag with a little race car that says admit one family because you're cruising into K.
Cruising into K, yes. It's our public school Grand Prix, really celebrating our public schools and the 13 elementary schools that we have to serve our incoming kindergarten families.
And do you have any idea what the normal kindergarten class size is?
Typically around 18 to 20, I would say, depending upon the school.
Okay.
So very nice, easy, comfortable atmosphere for them. Yes.
And they register in April. Do they do anything before the first day of school?
Yes. So if families have not already, we definitely want you to come to our Cruising into K event so that you can make sure your Focus account is set up, your student has an ID number, getting ready to go into kindergarten. We want to make sure you've had the chance to meet your school admin or someone from your school.
So they'll all be there.
They're all going to be there with open arms for our families. And we are calling that the Elementary Pit Row. So I'm telling y'all, it is definitely race car themed. You're going to love it. We have the enrollment alleyway. So that's where I was sharing with Focus. Families, if you don't have anybody older than a kindergartner, you're going to want to come and really learn how to get your child updated in the Focus system, because that student ID they receive will be with them throughout their entire high school career with us in Indian River County.
And there's so much that's done electronically on your website. It's just amazing
so much
to see what has changed over the last 10
lots
years.
And lots of years. I know.
Lots of years.
I know. Even me as a district, I've been in the district, I want to say we're coming up on 29 years. And our children came through the system. Like everything was paper pencil. Now everything is all online, from the forms that you complete for enrollment to uploading your immunization and physical to all the beginning of the year paperwork. It's really helped everything to become streamlined.
So I'm listening as if I were a parent of a kindergarten for the first time, because it would be like starting over. If we didn't have a computer at home, how would we manage that after the initial registration?
Absolutely. So we have different, especially in our early learning programs office, we have a kiosk that families can come and utilize if they needed assistance.
Okay.
The schools also have opportunities for families to go complete any documentation that they may need as well.
So it's not a, oh my gosh,
correct.
They haven't even gotten to school and already I have to buy things.
Yes, no, we don't need to do that. And then once they get to kindergarten, those computers are accessible for the children within the classroom.
Wonderful.
Yeah.
So cruising into
K. Yes. April 5th.
I'm racing. You're cruising. I'm racing.
10 to 12, the district office.
Okay, that's what I wanted to verify was the
definitely
time.
The district office, 10 to 12. It's a shortened period, and when I say we're going to roll out the red carpet, we are rolling out the red carpet. We are going to have, if your child's never experienced a school bus, they will be able to climb up on a school bus and explore it. We will have health services, so if there's any questions about immunization and physical, we'll have them there. We'll have food and nutrition. All of our departments will be there, as well as I shared the schools. And we'll also have a lot of our nonprofits that come to help. TCCH will be there.
We will.
We're so excited. Big Brothers, Big Sisters, Healthy Start, the Early Learning Coalition.
I bet the Learning Alliance.
The Learning Alliance. Moonshot Bus will be there. Not sure if Moonshot will be there, but Moonshot Bus and Learning Alliance, Moonshot Families, we're all going to be there in force, ready to welcome our incoming families, showcase the beautiful district office and all that it has to offer for our families as they continue down the path. As their child. I know, I love it.
So if they have attended pre-K, is there anything from the pre-K records that they should be bringing?
So they should, even though they have their ID number and their pre-K account, they still need to complete the registration for kindergarten. And that will happen within the Focus account.
Okay.
So they'll need to do that. And if there are any questions, we're going to have the experts right there. Everybody from enrollment will be right in that alleyway, computers set up, ready to answer questions.
Now, it's been a long time, a very long time since I've had a 5-year-old.
Same.
But I can remember bringing the 5-year-old and trying to focus on what people were telling me, and it was a little difficult.
Yes.
So is it okay if a friend or a grandma comes with?
Absolutely. The more the merrier. We're excited for that. Yes. And we definitely want your child to come with you because we're going to have the school. And there's going to be special surprises for our incoming Ks as they go through the entire process. And we want them to go to their school to meet their principal and to see what's going on and what there's going to be an activity that the principal does while they are there with the families.
Oh, I can't wait to see those.
It's going to be amazing. Yes, yes. They're excited and ready to welcome those new Ks. Many will still have their own on-site, on their campus kindergarten roundup.
Okay.
So those are a little bit more detailed, where they might be able to bring some extra paperwork or things of that sort.
Okay.
This one is more of a rally, come together, come see other kindergartners. Maybe you'll meet somebody who's also going to be on your school campus. So yeah, bring everybody. We want everybody to come visit.
Did I forget anything?
No, I think that's great. We're just, as I said, community partners, the district, the school bus. I think the school bus is the best part, especially for anybody who's maybe not had that. Transportation will be there to kind of explain how to find out if you're going to be on a bus, where to find your bus route, food and nutrition.
Your bus stop.
Yes, your bus stop, what time. Obviously, we won't have all of those logistics, but it'll help the families be able to find where that component is on the district website, as well as food and nutrition. So we can get our families online to at least complete their application so that when it's time to fully apply in July, they'll be able to do so.
So I'm doing the math here in my head as you're talking. I'm like, okay, there's 13 different schools and you set up to 20 kids in a class. So, I'm not a math whiz, but that sounds like a couple hundred people to students. I'm assuming that some of the more experienced parents where this is child number 2 or 3 or more might not be attending.
Right. We'd still love you to attend. I think that's the most important part. Every little one, whether you're the firstborn or the 10th born, we want them to have that experience. So while it might be old hat for a family, this is so exciting for our little ones, our incoming Ks.
It's a first for them.
It's a first for them. And we want to take those pictures. We want to make a memory for our little ones.
Okay. So, sounds really good. We're going to take a short break for a word from our sponsor, and then we'll talk about other early learning things. So stay with us. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs, and all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal Coastal Living, Four Seasons, Braxton Color, and Capri. We're also the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens and Pollywood. We specialize in fire pits, outdoor rugs, umbrellas, and replacement cushions. Right now, we're having a spring sale with lots of great markdowns and discounts on everything you need for your Florida home, including all pictures, lamps, and accessories half price. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet store directly across the street, filled with lots of brand name closeouts and sale items. And visit our website at sunshinefurniturecasual.com.
Get stoked, bro! It's the Downtown Beach Bash presented by GHO Homes. Catch the wave of fun and ride it all the way to downtown Vero Beach with live music by Riptide, plus kids games, beer, food trucks, and prizes. We're not hanging 10, bro. We're hanging from 6 to 9 p.m. Admission is free. Sponsored by GHO Homes, Sandpiper Pest Control, and Millennium Cremation Service. The Downtown Beach Bash, a Main Street Vero Beach event. Friday, March 28th, 6 p.m. Downtown Vero Beach.
And welcome back to Community Conversations. If you're just dialing in, my name is Vicki Soule, and I'm the CEO of Treasure Coast Community Health. What is Treasure Coast Community Health? Well, I think it's the very best primary care provider in town. But then I've been there for a long time, so I'm very prejudiced. But that's because I've used the services. It is not just a place for people who do not have insurance or have insurance with very large copays. It is top quality, easily accessible. We can get adults in within a week or two. We take all the insurances, including Medicare, Blue Cross, Aetna, you name it. So if you're looking for a provider, I can't give you a better recommendation. And yes, I am prejudiced, but so are the other 29,000 individuals that come to us annually. So feel free to give us a call at 257-8224 or look us up, TCCH. Today, though, I'm here with Brooke. Brooke is a dear friend. We work together with the Moonshot Moment Community Action Network. That is a great love of ours because it does start actually before birth with the importance of education, literacy services, all those things that make sitting with a newborn all the way through, well, 5th grade if they'll let you, reading books together and increasing vocabulary and getting ready for the big world, whatever that means at the place they're at now.
Yes, most definitely.
Yes. So your program, your early learning programs start at 3?
Correct.
Okay.
Yes. So families, if they have any concerns regarding developmental milestones, they are free to call our office to schedule a screening. We have someone from our Fiddlers, so our Florida Diagnostic and Learning Systems.
I love that name, Fiddlers.
Fiddlers, yes.
Fiddlers.
So we have a screener that comes a couple times a week to our office just for that. She'll screen for developmental delays, speech, and or language. And if she finds that for some reason your little one has not passed a certain area, she will set up an evaluation appointment with our school psychologist and our speech language pathologist.
And I do want to say that our pediatricians do all of those evaluations.
They do.
But certainly for usually first-time moms, but not always, if a pediatrician says, developmentally they're doing fine, except we like to capture the fine moment and sort of blow off the rest, okay? Because we know our children best. And so someone who is not with them 24 hours a day can be not feeling very trusted at some moments.
Absolutely.
And so this could be like a second opinion.
Absolutely. Okay. Absolutely. And what I appreciate most about our partnership is that when a pediatrician has a concern, they kind of let our office know. And Miss Claudia will typically call the family. I'm just following up. We received this from your child's pediatrician.
With love and care, not snitching.
Never. But also, do you have any concerns? Are you seeing this? Are you seeing this at home? And a lot of times the family will say, nope, not seeing it, and that's okay. We've got plenty of time before they go to kindergarten. And so Claudia will, politely say, we're here for you if you ever were to find something come up later on. But what I do love is the family, sometimes when they're outside of the doctor's office, will say, I'm seeing this happen, or I might see this. And Claudia will say, well, come on in, let's schedule you. And for the most part, I believe we're scheduling out about 2 to 3 weeks. Oh, okay. So they're getting into the office very quickly. And then once the screening is done, hooray. Yes. If they pass, yay, love it.
Yeah.
But if for some reason they do not, typically we're at about another 2 weeks for the evaluation.
Okay.
And then the parent will come back, or the guardian or whomever will come back with the child, go through the evaluation process with my school psychologist and my speech language pathologist, and we'll go through the different assessments that they complete. And then they will follow up typically another couple of weeks with our eligibility meeting, where the school psychologist and the speech language pathologist will share what they have found and whether the child would be eligible to receive any type of services based on eligibility criteria they may be able to receive.
So it is not a next day crisis kind of management. It gives all of us time to assess, evaluate, think about it. I know that there have been many times where I have had a conversation with a relative.
Yes.
And I'm not always a protagonist in this conversation, where, you just, sometimes you have to think and absorb and process. And meanwhile, your child is growing and changing and developing. So, we take parenting very seriously, particularly with the first one.
Especially with that first one.
Especially with that first one.
Especially that first one.
That's right. But it's wonderful that you have a team that kind of walks people through that.
Absolutely.
As well.
And that's why we say when we call the families or when the families call us, typically when the families call us, it's because they've had many folks, or they're just noticing, or there was an older child that was going through the same. So when Claudia asks her questions, then it kind of comes up. But also we say, you know, if this isn't time, give it 6 months. If you're still seeing it in 6 months, we're right here.
Exactly.
If you see it in a year, we're right here. So anywhere between the ages of 3 and 5, we're able to screen and evaluate, and we're able to provide services for those child if they meet eligibility criteria.
Having learned more than I ever expected to through the MCAN fellowship about brain development, it certainly is important for us to have those resources available for those that can use them. The earlier, the better.
Yes.
It's not a forcing situation, but these kids are sponges.
Absolutely.
But learning that the pathways that aren't fully used and developed eventually are stripped out of brain matter so that more important things, I guess, can
happen.
take their place. It is really important to know those resources are there.
And we
so
also
thank you.
and we also want our families to understand that just because they have the family and the child is eligible for certain services, they're always welcome to decline. Though we hope that they wouldn't, but not every child is destined for what we consider a separate setting. Okay. So not all children will go into a room with other children with disabilities. They may be in a general education class with students that are typically developing.
Okay.
They may just need some speech and language therapy. So they'll either be picked up from their preschool and taken to a therapist, or a teacher may go to their preschool.
So much greater flexibility than we used to see.
Absolutely.
I adopted a child he was in 3rd grade, and I said, "Tell me about yourself." And he did this. He
bless his little heart.
Stretched his little hand to make an L on his forehead, and I said, "What is that?" And he said, "I'm a loser." I said, "No, honey, you're not a loser. You're just a little bit behind your friends right now, and we'll get you caught up." It was so sad.
Yes, they know, and I think the biggest hardship for us and what we run into is our families and our parents who maybe had a disability or maybe had been in speech and did not have a good experience. So those are the families we really try to bring in and connect with and give a little extra cuddle to, because what they experienced as a child, I know is not happening in my program right now.
Thankfully.
Yes.
A lot has changed.
Definitely
Absolutely.
a lot has changed. And before a child even begins, they have a family connection meeting with their teacher. So they meet after school hours. Well, not after school hours, but after the children have left. Okay. They get to see the classroom, meet the teacher, find out about the routines.
So they've got time to see and think about it.
Absolutely.
So, since it's now March going into April, are you still going to do the screenings up through the end of the school year?
Through the end of the school year,
Okay.
yes. And our evaluations typically run until May. We have students who are with early steps, and we are required to meet their needs before their 3rd birthday. Okay. So we have scheduled in times for those who need it before their 3rd birthday, which happen over the summer. And then we resume immediately in August.
Oh,
so we always tell families, the sooner you can give us a call, the better. Yeah. And as I said, we're scheduling out. It's about a 6-week process.
That's what I'm thinking.
But it's a really fast process comparatively.
Yes.
So, it feels like forever. It feels like right at the next breath, but it's enough time to run through the program. And I'm very proud of our staff who get the reports written, who get the scheduling done. And then as soon as the eligibility is met, when a parent completes that enrollment paperwork and has everything ready, we're ready.
It's funny because during the break, you said we could talk for hours and we should talk about this, and this. And this wasn't even this one. And what we just talked about wasn't even on the hit
That's
list.
okay. That just means we'll have to do this again.
That's right. We will, because you've got summer school stuff
Yes,
starting.
we have summer.
Can they
coming.
find some of that on the web?
Yes, they sure can. Yes.
Okay.
Take a peek at our website. I do believe it's up here.
Okay.
And if you click on Step into Kindergarten, that is our most popular program. That's for our students who are matriculating from kindergarten or from VPK to kindergarten. If you have not utilized your VPK certificate, you may apply for summer VPK.
And with that, we're done. Thank you.
We are done.
Thank you.
Thank you, Ms. Vicki.
You're very welcome, Brooke.
I love it.
We will be back another day. Have a great evening.
Take care, y'all.